Hey guys, this is Coach Bricks, and I'm here with my man. I call him Dr. J. Dr. J. Dr. J delivered, right? Always delivered.
The little one.
Yes, hey, we're with RX Health and Fitness, all right? We'll explain what that is at the end if you guys don't already know, but hopefully everybody's getting that out there. But, Dr. J, I wanted to talk about, because, people have this question. Why should I go for a once-a-year wellness check or get blood work done? What's the importance of that kind of stuff? Is it important or is it not important? Is it just, heck, I don't go to the doctor because I don't really want to go. So why would you recommend somebody at least go once a year, a healthy person, once a year to get their wellness and their blood work done?
What was coming to mind when you were asking that question is don't ask, don't tell, or don't look, it doesn't happen. Absolutely not. So as a preventionist, or when a person comes in for a wellness visit, and a wellness visit is a person looking to get an idea and an understanding of where they currently are in life, okay, and what things to keep an eye out for that, guess what, you want to prevent, okay? So a wellness or preventative care visit, I know is very important. That's why I went into that field of prevention, okay? Based on a person's age, children early on in a child, I see infants and neonates and infants and young children. Yes, their well visits are spaced out early on in the first year of life, a few months apart. As you get to age 4, almost 4, that's when you go on a yearly. Okay, and all the way up through a yearly wellness visit is recommended, all the way up through until a person almost gets close to hitting, a Medicare age. Okay, Medicare age right now is close to 65. Okay, when a person hits 65 from a wellness standpoint, yes, they still want to look out for things and do an assessment to still know what to prevent. But because they are closer to or further than the middle age, where they are, the part of the wellness focus is, hey, what things need to be in place for a person to still continue to keep their quality of life. So a wellness visit for someone over the age of 65 is different than that 18 or 4 to 60, 65-year-old wellness visit that a person would want to make sure annually. Now, I do know we're talking about most adults, so when it comes to the wellness component, hey, a person you should see, your provider, your wellness provider, most often a physician, or maybe a physician assistant, nurse practitioner. I do understand there are more types out there, but a person coming in for a preventative wellness screen should be a good full physical, where a trained professional is able to look over the overall health, hey, how does a person's lungs, heart, blood pressure, weight, belly, all of those things, assess in person, okay? And then also you review from a preventative screening where there are certain disease processes and things that, yes, an ounce of prevention is worth a pound of cure. So things that you find, counteract, or address early, okay, is not the mole or the mound hill. Things like you still screen for prostate cancer in males, because why? If you find it, or you find it early, guess what? The earlier you find it, the better the prognosis, the better the treatment success, and the less you have to generally do. Okay, it doesn't have time to often metastasize, okay, or spread. Same thing for, women. Mammograms, pap exams, those things are very important for male or female when we start to hit our mid-40s. Those things where you just screen the colon. And I tell a person all the time, are we going to look for colon cancer? No, we're going to look for ways to continue to prevent colon cancer. So I say, don't let that make you fearful from going and getting a screening, okay? Certain individuals, if they have had a history of things they've done in their past, cigarette smoking, okay? Screenings that say, hey, a person between that age of 55 to 80 should have a low-dose scan of their chest to look for, guess what? Unfortunately, pulmonary nodules, or hopefully lack thereof, as a result of exposure to the lung of toxins or, nicotine use that we now know about, okay? There are more screenings and prevention, things that, we also look at in bone density scans. But when it comes to, and I think you wanted to know more about the blood work there in terms of, what a person wants to review or screen when it comes to blood work on an annual or on a preventative basis there, okay? For whether male or female adult or child. So the general standard for a child or a young adult below the age of 30, unless there is a reason that you see clinically that's pointing towards, hey, higher risk of sugars, obesity, cholesterol, metabolic syndrome, autoimmune, thyroid, other concerns, urinary concerns, usually the preventative level subset of blood work is optional, but a person or a child can receive a basic CBC, complete blood count. Looks at your blood cell lines to see if you're at risk of any anemias or lack thereof, infections or immunocompromised risk, lack thereof, bleeding risk with platelets, okay? A metabolic panel called often a comprehensive metabolic panel looks at your electrolytes, looks at your kidney function via creatinine, GFR. It looks at liver enzymes there, and then it also assesses, like I said, all of your electrolytes and proteins in the blood, things like albumin that we look at in a metabolic panel. Okay, protein assesses a person's nutritional function or lack thereof. So that's something in a metabolic panel that a person would want to look at. Cholesterol, basic screening cholesterol panel. I understand there are different subsets and types of panels that will look at a person's risk with their cholesterol, but still the basic, lipid panel that looks at total cholesterol, HDL, LDLs, okay, triglycerides, and then most will give what you call a ratio of the total cholesterol over the HDL, and giving a ratio less than 5 says, hey, in perspective, where cardiovascular risk is or is there or not. And we do know tons of information that not all cholesterol is bad cholesterol. Actually, cholesterol is needed for a lot of our vitamin synthesis, nerve cell health. So, no, not all cholesterol is bad, in moderation, like everything, sugars and anything. Cholesterol too high on one end is not good, okay? So you do encourage a person when you're reviewing those, but that's for the basic assessment of someone blood work wise that does not have any known concerns or predispositions to screen for. I do get some that, hey, my mom had this, my grandmom had that, my uncle had this, so when you find out, you dive a little further, there are some specialized tests if it's, something for an autoimmune condition, something for a thyroid condition, something for a different metabolic condition. There's tons of conditions out there, so you just dive a little deeper down and then you try to specify what labs at least put you down a path to make sure is there anything of a gross concern before you dive deeper. Okay, there's about 2,000 labs out there, and each can average from $20 to $1,000 per lab. So I would love in a world where we could just test everything under the sun and not bankrupt the person or the system. We would, but that's not for me to decide the price or those things. It's just more so the test. But you do try to lead a person down the right pathway. Okay.
Yeah, and I think you have a good point there. Let me just interject here real quick, because I think that's what makes our system different. You know what I mean? When somebody does come in, like myself, I'm a very curious person, so I have certain things that I want to look for. Me specifically, I've done my research, I've done that kind of stuff. I said, hey, Dr. Joe, besides the regular blood panels that we normally get, I want X, Y, and Z checked too. You go check it out for me. You said, hey, Dave, okay, this is what it's going to be. You know what I mean? It's still covered on insurance, or hey, you're going to pay out of pocket on, which I'm fine with. This is what it's going to be, and then we go get a test. And I think that's the beauty of what we're starting here, and what we have going here, is because we can customize, healthcare, where it's not just a general thing anymore. You know what I mean? Where it's not just a cookie cutter thing. Well, Joe, you have diabetes. That's what you need to do. Well, you're different than me. Yes, there's some general rules that we have to follow, but a lot of times we can dive deeper into those things. Absolutely. And that's where you do a phenomenal job, because you listen. I've gone to doctors that listen to you for 2 minutes and you're out the door, and I'm like, okay. You sit there and you listen, you take it in, you get it. You know what I mean? And then you listen to what I want to do. We'll have a discussion whether you might not 100% agree with what I say, but it's okay. But you listen to me and then tell me your side, and I tell you, this is what I want to do, and you listen to it. And I think that's one of the keys that you do extremely well, and that we do here, is that we listen to the patients, we listen to the people who come in, and then we try to tailor that as close to individualized as possible. And I think that's what healthcare has to be. Absolutely. It's not just cookie cutter thing of going in. No. Blood work is extremely important, but if you don't know how to read and you don't know what to do with it, it's worthless. Absolutely. You know what I mean? And that's where you come in. Hey, we need to get this down. But this is what we're going to do. I'm going to get you in with one of the guys here, Noah, James, Dave, whoever it is. We got to get you set up with these guys. You guys go get an evaluation at RX Health and Fitness, and then we need to get you rolling here. And I think that's where healthcare needs to be put. And that's what people need to take. They need to take pride in their health. And like I keep all my blood panels for all my last couple of years, so I can review and say, okay, where is my problem? That's what people don't do. You need to see, is there a breakdown coming? Oh man, and look, here's the decline over the last 5 years. This is where the decline. My vitamin D keeps going down. What do I need to do, Dr. Joe? Well, you need to get outside in the sun or whatever. I need you to take this supplement. You need to take this in. This is the key. This is what healthcare should be. Not what we see in these, these massive facilities. We need to make it more individualized, and that's what RX Health and Fitness is bringing. To this community. We're bringing this individualized program that these people can thrive on, get better, feel better about themselves. We talk, and I know you hear from people all the time. Well, it's my age. I don't believe in that. Chronological age is just an age. That's just a number somebody gave you.
It's a number.
Exactly, and you and I agree with this 100%. It's how you feel. And we can change that. You don't have to be, I'm 70 years old. Great. What does that mean? And that means nothing to me. You know what I mean? Let's get you feeling like you did when you were 30. You know what I mean? We can get you back there. It's going to take time, no question about it, but you got to be willing to put it in. And I think that's the key. And that's why I wanted to ask you about the blood panels, because I think they're important. I think they're extremely important. So then it's not just that first time, it's the next year. And the year after, so then you can see where you're going. Are they numbers
trends?
Going? Exactly. And we can mitigate it before it gets to that point, like you talked about prevention. We can mitigate it and get there. And we can tell, one of the staff here, Noah, James, whatever, hey, this is what's going on. We need to change this up now to get going in this direction. So any last words on that part of it with the blood panel, the wellness stuff?
One part you hit on that was very important. You said, you listen, and that brought me back to a mentor of mine when I first, started out in medicine. Physician, you just said it plain and simple. You say, you know what? If most physicians would just shut up, and I said, where are you going? Would just shut up and listen to the patient, they'll tell you everything that's going on and lead you which way you need to go. But if you cut them off or you're not hearing them, you're right. You got to do a full investigation. I have found that to be true. If you really just listen to what a person's telling you, they will tell you what they're predisposed to, what they're doing, what they're afraid of, what is going on, what's important to them. And that lets you know how to better, guess what, specify, cater to them, and get to a true intervention of health for that person. So the listening, absolutely. You touched on, they're right. There is a big difference between chronological age, how long you've been, I say, blessed to be on this earth, okay? We don't have to be blessed to be on this earth another day. Your qualitative age, okay? Your chronological age, okay? If your chronological age outdoes your qualitative age, I feel there's a problem. If a person is breaking even and your qualitative age matches your chronic age, your qualitative age, I say, you know what? That's good, but there's some areas for improvement. The goal is to, maximize however many years we're supposed to be here, but also, guess what, not playing with time and limiting our time if we're, guess what, meant to be here a little longer by some things that we can do. Okay, so if we can get that qualitative age even better than our chronological age, I agree.
That's key, because I call that quantitative, I call it the biological.
Absolutely.
You know what I mean? That's your biological that you can test and see, and it's amazing because I did a metabolic test, and it says that I'm 15 years younger metabolically, than my chronological age. My biological age is similar. Those are the things that you want to know, because that's what's going on the inside. And I think if people knew that, that's what we can do. You know what I mean? Because that makes all the difference in the world. You're exactly right. Chronological is just a number that is given to somebody.
You get one shot at this thing.
Exactly.
What are you going to do? How are you going to make the best of the temple you've been given?
Correct. 100%. Well, Dr. Joe, I appreciate another great one. You know what I mean? Always great with you. But guys, listen, check us out. Make sure you get hooked up. You know what I mean? reach in at Noah. Noah's here. He's awesome, phenomenal guy. He does the evaluations, gets you all set up, takes you through everything, breaks it down, really walks you through it. You got Coach James as well, who does a phenomenal job. You know, I'm here. Dr. Joe stops in, helps us out, you know, when he's not doing all his other stuff that he has 15,000 other things that he's doing, you know, going on and stuff. So we're here as a team.
Yeah.
We're a team.
Absolutely.
We're all working together. We're all in communication. If there's a problem, one of us maybe doesn't know, guess what? We go to somebody else and they have it, and that's how it works. We're not one of these guys where I'm over here, somebody else is over here, and we never communicate. We're always communicating. So reach out to us. Let us know how we can help you, get you on the right path, get you back, like we said, the quantitative or that biological age down. All right? So you're living much longer, healthier, and happier lives. So Dr. Joe, appreciate it, my man. Guys, reach out to us. Be blessed. God bless you guys.